think me, depending on how your screen looks, is Eric Arlia. He's our System Director of Pharmacy for Hartford HealthCare. Ajay, we're going to kick it off with you for an introduction. We'll take questions after we're done. If you guys can put your questions in the chat room, that way we can go in order that we receive your questions. We'll get those answered for you. So Ajay, take it away.
Thank you, Tina. Good afternoon, everybody. This is quite a busy week for all of us, learning a lot about the new boosters and vaccines. And as we know, there's a fair amount of excitement based on ACIP and CDC's discussion on this week. And we were hoping to present at least what Hartford HealthCare's planning is and how we're addressing it this time. I do want to underline the fact that the news and the information is evolving every minute, every hour, in a positive way, in my opinion. I think that things are getting a little bit more clear as time go by. And we are very excited that the FDA and ACIP were able to meet this week and make some decisions about where to go with the boosters. I do want to assure that Hartford HealthCare is ready to provide and create access for vaccines and boosters for all the community as needed, as approved, and as appropriately authorized by FDA and CDC and state officials. Our website is updated at this time with appropriate locations where one can register through MyChart or otherwise to seek boosters at this time. We are in the process of updating details based on the new information which is arising. But Eric Arlia, my colleague, is going to go into some more details about which segment of the population is approved or appropriate for vaccination boosters at this time through Pfizer, and then we will address some questions at this time. Thank you, Eric.
Sure. Thank you, Dr. Kumar. So I just want to briefly go through the final recommendations that came from the CDC late last night. So I'm basically going to speak specifically to 4 different categories that were reviewed. The first category, I think the easiest one, is that the CDC recommends anyone over the age of 65 should consider getting a booster as long as it has been at least 6 months since they completed their first series of the vaccine. And again, as a reminder, everything that we talk about today is specifically related to the Pfizer vaccine. There is no recommendations or approval or guidance on switching from one brand of vaccine to another. So everything I'm going to talk about is related to people who received the first series of the vaccine with the Pfizer brand. The second category that was reviewed by the ACIP committee and the CDC leadership is people who are between ages 50 and 64, who are at significant risk for severe COVID based on disease states. The CDC has a comprehensive list of those disease states on their website. Heart disease and diabetes, I think, are the 2 biggest disease states. There's many others listed on their website. And again, that was a strong recommendation that those individuals should receive the second, receive a booster dose. The next category is individuals aged 18 to 49 who have risk of severe COVID based on a disease state that they may have. This one, the recommendation is that those individuals should consider getting a booster dose of the Pfizer vaccine. They should weigh the risks and the benefits and speak to their healthcare provider if they have any questions related to it. And then the last category, which was the one that kind of changed as the day progressed yesterday, is individuals who, based on their work environment, may be at higher risk of exposure to COVID vaccine. And again, the final recommendation after Dr. Rachel Walensky reported on it late last night was that those individuals should also consider getting a booster of the Pfizer vaccine. So the first 2 categories have a little bit of a stronger recommendation than the last 2 categories. What we'll be doing and what we're in the process of doing today is updating the language on our system, our MyChart system, where people can make appointments to get vaccinated. And it'll be asking them those questions and asking them to attest to falling into one of those categories. And once they do that, they will be able to see the locations that we have appointments available at. Currently today, we have 17 locations that have COVID vaccine clinics. They all offer the Pfizer vaccine. That list is available on, there's a link right off of the Hartford HealthCare homepage. It lists the locations of those clinics and it lists their current hours. We are asking at this time that people make an appointment to get a booster dose of the vaccine. This will help us make sure that we have adequate supply of the vaccine available at all of our clinics. We'll be watching the registrations very closely. We'll be monitoring it throughout the weekend. If there is a sufficient demand, we will increase hours of operation or add extra locations. But we feel very confident that we definitely have plenty of vaccine. I can assure everyone of that. As I've been saying throughout the week, there's no issues with supply. And we will just continue to check on our schedules and make sure that adequate appointments are available for anyone who falls into those categories and wishes to get a booster dose.
You know, and I was going to say that the situation is very fluid, that things are changing very rapidly, and we're agile in this. So I don't know, Ajay, if you want to elaborate a little bit more on that.
Yeah, I think, Tina, thanks for pointing that out. Since the middle of the week, we've had multiple conversations and news and media releases happening from Washington, D.C. and other areas. We're keeping a very close eye on that. We're working very closely with the state officials. Ultimately, we'll be guided by what our Department of Public Health and CDC and FDA are advising us at this time here. We're going to be very consistent with state policy. So what we are planning today and over the weekend to make sure that our clinics are well stocked, we have appropriate language and information as much as we know, updated on our websites, and we will change it if the new information arrives. We feel very confident, as Eric mentioned, this is a very positive step from CDC and FDA. And I'm excited that we are able to offer the booster to a larger community at this time. This is going to make our place safer and community safer. So it's a good and positive direction, despite some confusions and some different information which is coming out.
Great, thank you both. We don't have any questions in the chat. I know there are questions out there. Oh, actually we are. They're coming in right now. Caitlin from NBC Connecticut, can you describe the attestation process? And this, yeah. Eric?
Yeah, sure. So again, we've drafted language based on the guidance from all the agencies that we noted. If you use our MyChart system to schedule an appointment, there'll be a prompt that comes up that asks you to attest to falling into one of those categories. When you get to our clinics, you'll also sign an attestation. It's an electronic process. There's no paper involved. It'll be similar information.
All right, thanks for that question. Mike Savino from Channel 3. Can this newly eligible group get booster shots today, or are some things you're talking about part of getting ready for it?
So we're in the process of making programmatic changes to our technology system today. Much of the information we're talking about today didn't get finalized until after 9 o'clock this morning. So there is some setup time that's needed to make sure that everything in the system functions correctly. We feel very confident it'll be ready by the end of the day today. There's a possibility it could be ready sometime during the afternoon, but really our focus is to have everything ready so that people can schedule appointments starting on Monday.
Mike, I do want to remind that for immunocompromised individuals who are seeking boosters, our system is up and running and ready for accommodating those patients as well. And we should be stressing that there are a fair amount of individuals with immunocompromised status who qualify and eligible for vaccine booster should get that.
And if you had Moderna or Johnson & Johnson, can you still get this booster shot?
Not the Pfizer brand, based on the current recommendations and guidance. Both Moderna and Johnson & Johnson are in the process of submitting data to the FDA and the CDC to obtain similar approvals. Once they do that, there'll be a similar process where the FDA's advisory committee and then later the CDC's ACIP advisory committee review it. And I expect that we'll have similar updates for those, hopefully within the next few weeks. But at this time, it is not recommended to interchange brands.
All right, Eliza Fawcett from the Hartford Current. How would you describe why these booster shots are important for those who are already fully vaccinated?
Mike, Eric, you want to take this one?
Sure. I think what we're finding is, the research that Pfizer had done. We're starting to see some breakthrough infections from some of the age groups that we've discussed. And while their symptoms appear to be more mild than someone who wasn't vaccinated, I want to stress that we're finding this is a new vaccine, it's a new technology. Keep that in mind. So we're studying it and we're researching it as we go. So really trying to find that sweet spot on when a booster would make the most sense is what the focus of the research has been. And based on evaluating different types of patients with those comorbidities that we talked about, or based on their age, it seems like this is a point in time where it can be making a difference for those populations.
All right, Mike Savino from Channel 3 with a follow-up question. Do we know who is in the category of jobs that create high risk?
I'll take that. Mike, is a great question. We don't have a clear guidelines or guidance from our authorities we just mentioned earlier on, although CDC director has made a direct comment regarding the healthcare workers and some high-risk jobs at the moment. We are waiting for further clarity on that. We are going to be updating our website as things progress, and I'm hoping by Monday we will have a clear understanding which job categories would be considered as a high risk. I hope that's enough for now, but we will keep our website updated.
Our next question is from Peter Yankowski from Hearst, Connecticut Media. What documents should someone take with them for their booster?
If you have your vaccine card, it's ideal to bring it with you. First of all, it allows us to very easily show that you received the Pfizer brand. It also lets us verify that you finished the series at least 6 months prior. And I think most importantly, it allows us to document your third dose on your original card. So that's the ideal situation. So now is a good time to dig that vaccine card out if you don't know exactly where it is. We'd love to fill it out for you, keep all of your data on one form. If you did receive vaccination through us at Hartford HealthCare, we obviously also have that information in our electronic health record. We also have access to vaccine info for people who are vaccinated at other sites in the state of Connecticut through the CT Wiz portal.
We have a follow-up from Caitlin at NBC. Do you have to show proof of having a condition that makes you high risk of getting COVID, or signing the attestation helps people stay truthful, or hope they stay truthful?
So we're asking you to do a test to having one of those conditions. It's not really practical for us to verify that for you. That's the process that we're planning to roll out in our system. It does put the onus of being truthful on the individual. I feel like we've had a few other scenarios where attestations were required at different times, and I think people do the right thing and are generally truthful, and we haven't had major issues with it in the past. But again, that's as far as we're going to be taking it. It would be incredibly complex, and there would be a lot of gaps for us to try to do that. And try to verify that through independent means.
Great, thanks, Eric. Dr. Kumar, question for you from Eliza at the Current. DPH Commissioner Dr. Juthani said yesterday she was, quote, cautiously optimistic about Connecticut's COVID-19 trajectory. Do you share that same feeling?
Yeah, thanks for asking this question. I think I share her opinion, excuse me, especially we've seen some positive signs. We've seen a decrease in positivity rate. We have seen some decline in hospitalization as well. So I share her optimism at this time. This surge or this peak at this time has taken slightly longer to taper off, especially in the hospitalization side. But I'm optimistic that this is going to improve over the time. I do want to mention that we still are seeing patients who are unvaccinated coming to the hospital. We're still seeing those individuals getting significantly sick and high mortality as well. So it's still a reminder for those unvaccinated individuals to seek vaccination. Among the vaccinated one, the breakthroughs, we continue to see fair amount of incidental breakthroughs in the sense that these individuals come for different reasons, such as fall and some fracture and things like that, and they are noted to have COVID-19, generally with very mild or asymptomatic disease related to COVID-19. So it's really important to continue to get the vaccination, and I think that would get us far in this pandemic very quickly.
I just wanted to add one
Yeah, go
thing
ahead.
on that. I wanted to just make sure everybody knows that if you're coming for your first dose or your second dose of a 2-dose series of a vaccine, you can still walk into our clinics. We're asking people coming for the booster to register ahead of time, because obviously that's a new grouping of people, and we have to manage the demand and make sure that our clinics have enough supply and enough resources to treat everyone effectively. But we still want to make it as easy as possible. We're not losing sight of the fact that people who haven't received the original vaccine is still very important to us. And if you're able to, or you've decided to get that first dose of a vaccine, you do not need to make an appointment. You can still come to any of our clinics during their normal hours of operation.
Another question from Peter from Hearst, Connecticut Media. Will you be checking WIS to make sure people won't apply for a booster when they don't qualify?
So like I had said in my earlier comment, if you come to one of our clinics, we're going to be, the things that we will be checking, you know, we talked about not checking disease states, that's an attestation, but we will be checking to see that you received the Pfizer brand and that it's been at least 6 months since you completed the original series. So here in the state of Connecticut, the CTWIS portal gives us access to that information. So if you didn't have your card or you didn't get treated at one of our vaccine clinics, that is something that we will check just to verify that it fits the criteria.
Nicole Leonard from WNPR Radio. A lot of the discussion and arguments among ACIP panel around recommendations for boosters for people based on occupation and risk of illness was about data or lack thereof around breakthrough illnesses among healthy vaccinated workers in high-risk jobs. Does Hartford HealthCare have information on how many clinicians have become ill with COVID-19 since getting fully vaccinated? Ajay, do you
Nicole,
want to-
yeah, Nicole, it's a great question. And it's a difficult one to answer as well. Let me try to explain how and why. We track our colleagues across the Hartford HealthCare who may be positive through our occupational health processes, and we have seen a significant decline.
Okay, so go to that,
Go ahead, Ajay.
Yeah, we have seen a significant decline in those individuals who may be positive. And this is because of our vaccination mandate as well, which has had significantly positive effect. A lot of people have been vaccinated. But we understand the whole idea about the booster is that over time, it does actually have some decline, a little bit of a decline in their capacity to be able to fight off COVID-19. So the boosters are given to protect what is to come. We are not seeing significant infection, and I actually wouldn't be able to give you the numbers, in fact, of how many clinicians may have been positive. But number of sick days and individuals who are leaving work for COVID or otherwise related is very small in Hartford HealthCare. That's a positive sign. So I would also, going back to the earlier comment, encourage everybody to get the vaccination and stay protected.
All right, I don't see any additional questions in the chat, so we can start with final. Actually, Mike from Channel 3 has one. What are we seeing with immunocompromised getting the booster? Is it what we had expected?
Mike, we have seen mixed response. I would have expected a tremendous appetite for immunocompromised to see boosters, and some of that has been, I would say, very less response than I expected earlier on. I'm hoping that more immunocompromised individuals will come forward and get the boosters. Some of that is because they're probably feeling well and they're feeling protected. And some of that is the communication challenges we have nowadays. So I'm hoping those individuals will come forward and get the boosters.
All right, with just a few minutes left, we can start with final thoughts. I don't see any additional questions. We will, of course, ask if we see them appear in the chat. But Eric, any final thoughts to the group?
No, I guess the one thing I would say is I was at one of our vaccine clinics at the Hartford Hospital Community Pharmacy yesterday, and our providers are really excited to begin to offer the boosters to those people who are eligible. We should have our IT systems updated sometime during the day today. We're really looking forward to filling those schedules up starting on Monday. And I would just say that if we do fill them up, we stand ready to add additional days and times to meet the demand. And we're looking forward to getting this done for everyone who's interested.
All right, thanks, Eric. And Ajay, final thoughts?
Well, as I started the conversation, Tina, it's a positive step at the moment. I want to see the conversation, evolution of the information as a positive step in every possible way. I'm really excited that we are able to offer the boosters. I think it's the right thing to do. And further guidance will come forward through state and other officials, and we'll make sure that we keep our public updated. I request and encourage everybody to visit our website periodically. Because things will change as information evolves over time. I'm hoping that everybody will stay safe and choose to get the vaccine and the boosters as appropriate.
Eric, Dr. Ajay Kumar, thank you for joining us. Thank you all for joining us. As you know, as Ajay mentioned, just to reiterate, this is very fluid time, and things will consistently change, and we will continue to remain agile. And of course, keep you all abreast of the latest changes. So stay tuned. We will, of course, conduct additional media briefings as necessary. But for now, thank you for joining us and have a great weekend.
Thank you.